I'm Dr. Shaz Wahid. I'm the Medical Director at South Tyneside NHS Foundation Trust. I'm a practicing consultant physician in diabetes, endocrinology and emergency care, and I'm the overall clinical lead for the Path to Excellence programme. So we're moving into Phase 2 for Path to Excellence. So what is Phase 2 for Path to Excellence? This is where we describe to you the hospital service changes around three broad areas. First area being, how do we manage emergency care? How do we manage patients with life-threatening conditions, patients with emergency conditions that present to our emergency departments who then require admission? How do we manage patients who require an emergency, immediate operation for life-threatening conditions, emergency surgery? And thirdly, how do we manage planned care? How do we manage patients who require a hip replacement, a knee replacement, or a gallbladder removement? How do we manage patients who are referred for an outpatient opinion by the GP? Of course, we need to be cognizant that to support these three areas, we need to make sure our clinical support services also manage these changes: physiotherapy, occupational therapy, imaging, scanning. Path to Excellence is only a part of the bigger picture. We need to make sure that we work with our GPs, our community teams, with our local authorities around prevention, make sure our population remains healthy. If they develop conditions, that we actually make sure that they are managed appropriately and reduce unnecessary hospital admissions. South Tyneside and Sunderland deliver outstanding, compassionate care. For us to continue to do so, we need to manage a number of challenges which are with us already and challenges which are around the corner. We need to work together for us to continue to deliver the best outstanding possible care. No change is not an option. Moving forwards, the challenges we have are particularly around workforce. So we have gaps in certain services which we're having to fill with temporary staff, where we're having to ask our staff to work over and above what they currently work, which is not good for health and well-being of our staff. We have small teams who can't necessarily keep up with the advances in medicine. We need to make our teams more resilient. So workforce is a huge challenge. Our patients are living for longer. Patients are more complex. They have multiple conditions which need managing. The traditional way we set up services will not allow us to actually sustain and keep up with the complexity of our patients. It's important we also make sure we keep up with the advances in medicine, but sometimes the best way to keep up with the advances in medicine is to make sure there's no variation. So variation care should be the same 7 days a week. We should make sure we deliver the right care at the right time by the right person. If we do all this, we actually reduce the amount of money we're having to spend at the moment. We're having to spend more money in the NHS, particularly in our hospitals, than what is actually coming in at the moment. I've worked in South Tyneside for 15 years. I've worked in the NHS for 28 years, all in the North East, from medical student onwards. I'm very passionate about South Tyneside and the NHS. We value your feedback. It's important you get involved, and also to give you the assurance that both South Tyneside District Hospital and, for that matter, Sunderland Royal Hospital will not close. Both have a bright future, and we need to work together.